And I have a 4-year-old that may pop in at any point. So.
Yeah. Me too. Dogs and kids keep walking in and out.
Yeah. So, all right, we are now on. We've got 2 people that are watching. So if anybody that's listening can give me a thumbs up and let me know you can hear. All right, cool. So we got some people coming in. Can you guys hear out there? Barry, I see you're on there. Can you give me a thumbs up? All right, cool. We're getting some reaction. So that's good. All right, so I'm going to start off, everybody. This is State Representative Erick Allen. Thank you guys for joining in, whether it's live or if you listen to it on recording. Thank you guys for jumping in. We all know that it's a lot going on, and I've been honored to have a couple of people who have joined today, and they're going to give some remarks and then probably hop off, or they can stay on. I've got Dr. Jenni Memark from the Cobb County Department of Public Health, Cobb Douglas County Department of Health, and Jenni Shover, who is a small business lender, and she'll be talking about some of the SBA loans and processes that are coming online. And I've also invited, and hopefully we'll have participants from the Department of Labor that'll come in and talk about the unemployment process. So this week I wanted to focus mostly on one, just kind of an announcement on the public health side, but also on the personal finance, to make sure that everyone had information they needed around unemployment, small business lending, et cetera, to make sure we all survive this. This is unprecedented times, and I'm so happy to have the fonts that we've had to address these issues. Before we go to Dr. Memark, I do want to do 2 public service announcements. One, it's census time. Yesterday was Census Day. Everybody wanted to go out. It wasn't April Fool's Day, it was Census Day. If you got your form in the mail, go out, and you probably saw me talk about it yesterday, but you should have gotten an envelope that looks like this. Go online and make sure that you take care of your census information. It'll take about 5 to 10 minutes, depending on the size of your family. And if you did not get the letter, you can still go to my2020census.gov and complete the census. So make sure you do that. Also, I just want to give kind of a PSA around scams. We need to be very vigilant right now with the federal government sending money, with so many programs going on. If you get a text message or an email for someone asking for your bank account information, saying they're the IRS or they're the government, please be suspicious. Trust me, the federal government does not need to text you for your information. If you filed your taxes, they've got your address, they've got your banking and routing information for your direct deposit. You do not need to submit that information. So if you do feel like you're getting some information that is erroneous, and you feel like it's a scam, please contact, either email myself, my office, or call the Attorney General's office, law enforcement, but do not give personal information over text message or email. Last thing I'll say before we go into Dr. Memark is the election. Right now, there's been a lot of questions I've gotten over the election, some talk about moving the date. The understanding right now is that the date will stay May 19th, unless there is authorization from the legislature and the Secretary of State to move that date back. So you should be getting your application in the mail in the next couple of days. It is just an application, it's not the ballot. If you get the application in the mail, that's where you will request the choice of ballot that you want, whether it be the Democratic primary or the Republican primary, and then you will be mailed a ballot based on that. You will have to provide postage as it stands right now to mail in the ballot, but polls will also be open on election day. My understanding right now is that by law, they cannot close the polling locations. So if May 19th is the election day, I strongly encourage you to vote by mail. But if for some reason you can't, locations will be open. I think that was it. So now I'm going to turn it over to Dr. Memark, Director of Public Health for Cobb Douglas, and take it away, Dr. Memark, and give us an update on where we are.
Thank you, Representative Allen. So thank you for having me today. And I want to thank everybody that is probably stuck at home. I know this has been really hard, but it's extremely important that we do this right now. Some of you may see the updated numbers that have come out. There's been some jumps recently. We're over 5,400 for the state of Georgia right now with 176 deaths. So Cobb is standing at 341 cases, and then Fulton has the highest number of 747 cases right now. And so, you know, these are quite concerning numbers for our district here because they're in the top of the state of Georgia. And so we really had to do the most aggressive measures. A lot of times you're going to see the areas that are a little bit more densely packed that live closer together. Oftentimes you'll see some of this. And so I wanted to just make sure that everybody understood it. The sheltering in place is so very important. And you know, we in Cobb County, the first segment of that was the closing of the schools, and that was really, really important to do that because we took about 150,000 people out of circulation at that time. And then, you know, doing the businesses as well, that has been huge. And then what the governor has done today has been tremendously helpful. So we expect, remember, there's going to be a little bit of a lag. So right now we're going to see the increase in cases because we have increase in testing, as well as we are seeing the effects of 2 weeks previous to the sheltering. So, or 2 weeks previous from the present time. So whatever was happening 2 weeks ago, you're going to see that now. So it's very important that we continue so that we can break the cycle of transmission, because remember, we don't have any vaccines and we don't have any treatment. And I know for Cobb, I watch the hospitals very carefully, and their acute bed inpatient stays are not too bad, and ER is not too bad. But when you look at the ICU capability, that is starting to get to capacity. And that's something that we have to keep in mind, because there's only so many ICUs that can be open. We have to protect those for and make sure that we can spread those out so we can take care of our citizens that need it the most. So this is why it's so important that we do this. I know there's a lot of questions about testing, and the state of Georgia is working very hard. The Department of Public Health with the governor's office and with the federal government, they're working really hard to get more testing. And so we do have, you know, a steady stream, but it's a smaller stream that we're doing high-risk people right now. But I talked to the hospitals this morning, and they have a little bit of an increase in capability than they did previously. So remember, we think that, I don't know about you all, but I feel like this has been going on a really long time. It's only been a month actually. And so we've been able to put a lot of things in line in a month, and we forget how quickly this is moving. So it is happening week by week. We see a lot of increases, and so that's really important. So I want to really end on, so when we get more testing, we'll be able to do that. But I just wanted to just reiterate how important it is for us to stay at home. The governor has given us a chance to try to break this cycle, and all of us to do it all at one time. And so please just hang on a little longer so that we can really stop the transmission of this disease. You might have heard that the CDC has really proven that we can pass it when we don't have symptoms. We thought that was happening over the last few months, but now they really have been able to confirm that with evidence. So you don't know if you have it, and so you got to stay away from each other so we don't spread it. So thank you so much. I really appreciate it.
Well, thank you. I know that you mentioned the governor's shelter in place, and that kind of came out about an hour or so ago, so it's fairly new. One of the things that you know, I want to reiterate that is that we do take this serious. We do shelter in place. We only go out for those essential services. The governor's listed what he considers the essential services, so I'll make sure to post that online or on Facebook, or either on on Twitter or somewhere as we get closer or as we know more, so that everybody's fully aware of what's considered essential, what's non-essential, because the violations have been outlined as misdemeanors if you are caught in violation of not adhering to the shelter in place. So I want everyone to take that really serious. We don't have any questions as it looks right now from Facebook. But if you guys do have any questions, just type them into the comments section so we can see those questions. And then we will ask them of Dr. Memark. All right, so Barry, looks like you've got a question. Are you typing it in or? So the one question came in about PPE, the situation with PPE. Do you want to give an update on that, Dr. Memark, and then I'll talk. I'm pretty sure it's leaning more toward the sterilization part, but I'll let you handle the general part.
Okay, so we got a little bit of a eye-opening update before I took this call, that the Strategic National Stockpile, we're kind of at the end of our availability that they have with the PPE. And so it was stressed to us very, very strongly that if you are a healthcare worker or EMS frontline worker that's using it, that we need to be able to make them last as long as we possibly can right now, because we don't have the storage of the stored PPE available as much anymore. So we will have to look to getting them commercially. And I know the state has an order in place that should be here in the next few days, but you know, the supply chain is very precarious. And so we just have to try our best with that, with the PPE and try to make it last as long as we can.
Are the shortages a statewide issue?
No, it's not just statewide. This is a nationwide issue. And so everybody's looking at backup plans. So this is not, everything that's happening right now is not just the state of Georgia, unfortunately.
Okay, and kind of a follow-up on that. I know there are a lot of people that want to volunteer. They're making masks at home. They're doing, what can they bring that to your office? What's the process if someone wants to participate and help out? What can they do?
Well, you know, that's interesting because the chairman's been, for Cobb County, has been talking about the same thing because, you know, there's a lot of talk about whether you should wear masks and if we run out, and he knows a bunch of people that also want to help. And so, yeah, I mean, you could reach out to the Department of Health if you want to make some of those and have them delivered, because I think we are going to need a backup plan eventually. And I think that's probably going to be one of the really good ways to be able to do that. So.
Okay, and I think that addressed, someone had asked the question about should non-medical folks be wearing masks, and I think the general census is how do you answer that right now? I mean, it'll probably change in 2 hours, but.
Yeah, but if you're sick and you have to go out or be around people, then you definitely need to wear one. But that is being right now reviewed, and so like we said, it could be a completely different story tomorrow. So keep watching.
Okay. And someone asked a question about mall, and I don't know the answer to this question about malls. Are malls open or closed right now?
Oh, that's a really good question. So I think we'll have to look. I don't think they're going to be essential, right? So infrastructure. So
yeah, I would think. Edwin, you asked that question. I'll send that out in the inline of the chat.
Yeah, we have
to make sure everybody's aware of that. That's a good question.
Mm-hmm.
And as far as sterilization, I know that question is probably getting at the Sterigenics issue and what needs to be done. Right now, I would just say that's in the court's hands. I've always stood by the fact that for the PPE that's needed, it doesn't need the level of sterilization that ethylene oxide provides. So when you look at the shortage of PPE, you're really talking about a supply chain issue, not a sterilization issue. And I think we need to stay focused on that and focus on the supply chain and getting what's needed to the medical workers on the front line. And now that that's in the courts, we'll let the courts handle the rest of the argument.
Yeah, and I'm not super familiar with, I should be, but I'm not right now, of the, they have some new disinfectant ways for some of the PPE, and the cdc.gov website will give you all the updated stuff, but they're trying to stretch out the PPE as long as possible. So if you need to see that, the most updated stuff is on the CDC.
Okay. Well, that looks like all the questions that we have of you. I know you've got a lot going on. So Dr. Memark, thank you for joining. And if anybody has any questions, how can they reach out to your office? What's the best way?
If questions we have, when you go online, there's an inquiry.
Okay.
I don't know what you call it. You just put it on there, the request, and they'll respond back to you.
Okay.
We're used to those. Okay.
Okay. Good deal.
Thank you, everybody. Right. Stay home, okay?
All right. Thank you.
Bye-bye.
All right. So, Donna, are you with Department of Labor?
Yes.
Yes. Okay.
Actually, I'm Denise Beckwith.
Oh, Denise. Okay. It says Donna on there. So
Yes.
Denise, thank you for joining. I know we've been emailing. Denise Beckwith is the Director of Unemployment with the Department of Labor. And I've asked her to come in and just share with us some of the updates that's going on with unemployment and what's going on with the Department of Labor and how people can get squared away. So Denise, if you can give us any updates you guys have.
Okay, so as you all are aware, in the last 2 weeks, we have received record-breaking amount of unemployment claims. Last week alone, we processed over 1,100% more claims than we did the week prior. The week prior, our claim numbers were 12,000 claims. Last week, we processed 133,000 claims. So we are extremely busy at the Georgia Department of Labor, and we are on course to even break more records this week. We also have adopted a few rules to expand eligibility for our workers and also the number of weeks that individuals can collect benefits. We also adopted a rule on March 19th that mandated employers to file online partial claims on behalf of their workers who are either temporarily laid off for a short period of time due to the COVID-19 or who have had their hours reduced. This includes both full-time and part-time workers. We also have been working with our IT department to enhance our systems to make them easier for the customers to process their claims, track the status of their claim, reset any PINs, and also to select the payment method in which they want to receive their unemployment benefits. Now, we get asked a lot regarding that rule I just spoke about, requiring employers to file on behalf of their workers. And so we receive calls from workers that indicate that their employer has indicated they are not going to file on their behalf. We advise them if they are out of work for the reason of COVID-19, they can go on our website and file a claim on their own behalf. They need to go to our website, look under online services, and there's a link that will say file an unemployment insurance claim. So they can go ahead and do that if their employer is not going to file on their behalf. But most importantly, one of the things that I want to tell customers, I know we have just been overloaded with calls and emails coming into this agency. But we just ask that you be patient. We have staff, we're working long hours, overtime on weekends. We're trying to respond to all the emails and calls from customers and employers, and we're trying to reach all of you and provide assistance.
And I just want to echo that the Department of Labor has done a tremendous job of getting this up and running as fast as they have. And I know one of the questions still dangles out there around the self-employed, the gig workers, contract workers. Those you will be eligible for benefits under the CARES Act. However, the website or the portal is not ready yet, but hopefully that'll be up soon.
Yeah, let me explain that. the CARES Act, there are several provisions within the CARES Act. Those are federal programs. And so when, and what happens is this, the state DOLs around the nation, we actually are tasked with administering these programs on behalf of the federal government. Now, what we have to do is before we can implement a program or release funds, we have to receive guidance from the federal agency on how they want us to operate these programs. As of today, we are still waiting on guidance from U.S. Department of Labor on how we will operate and how we will distribute, because we're receiving many calls about that extra $600 payment. We're ready to go. We're waiting for the guidance, and we're hoping that something will be coming out from the U.S. Department of Labor soon.
Okay. And just for clarification, for the $600 additional disbursement from the federal government, when that's enacted, will it be retro? Will it go back, or will it start at that point in time?
No, it will go retro, but we did have a call with USD Department of Labor today, and they did kind of share some of the guidance and some of the requirements. They did tell us that the first payable week of the $600 is going to be this week. So any week paid starting this past Sunday will be the first $600 payment.
Okay. And if there are any questions around this process, just put them in the chat and I'll make sure we ask them. You mentioned it, but I just want to clarify the benefits have been extended from 14 to 26 weeks, I believe.
That is correct.
And
so any claims filed on or after March 14th will automatically have your weeks extended to 26 weeks. You may have already received a decision that will show that your weeks are at 14. We're working at doing recalculations and getting those new redetermination letters out to you, but you are eligible for the 26 weeks.
Okay, and also, can you explain the difference now under the unemployment rules, Georgia unemployment rules? If you make $50 a week, then you are not eligible for unemployment. Under this new rule, the temporary benefit is if you make 300 or less or over, you're not eligible.
Let me explain what that is. That's called the earnings disregard. So our old rule allowed you to work and earn up to $50. Then anything after $50, we deducted dollar for dollar from your weekly benefit amount. We've expanded that, so now we are allowing workers to work and earn up to $300 before we will deduct dollar for dollar from your weekly benefit amount. So technically, if you qualified for the maximum dollar amount per week, which is $365, and you're working part-time and say you earn $300, you would receive your $300 from your employer, $365 from the state of Georgia, and you would get the $600 from the federal government program.
Okay, thank you for clarifying that. It doesn't seem like we have any questions, so Denise, I'm not going to hold you. I know you're extremely busy.
Can I just say one thing?
Yeah.
I ask your viewers to follow our website. We have a lot of information on our website. Also, our social media. We're releasing information daily and updating people. And again, we will update when we get the guidance from USDOL. We will immediately update our website with the information and provide people with information on how they can file for these programs.
Okay, thank you. And okay. I'll follow up with the website and any other information that pops up. And if anybody has any questions after this, you can either contact me or the Department of Labor, and we'll get those answered. I know a lot of people, as Denise said at the beginning, have been impacted and lost their jobs. And we want to make sure that every resource that is available is being deployed. And like, once again, I just want to thank the Department of Labor for being so open, so responsive. And I know you guys are exhausted, but thank you for the work you're doing. And please tell your team the same thing. So thank you.
Thank you so much.
All right. Thank you, Denise.
Bye.
All right. So the last topic that I wanted to cover tonight, and Denise, I know you're busy. If you want to drop, you can.
Yeah, we're
okay, thanks. If I want to move on to Jenni. Jenni is an SBA lender, has a lot of experience in the field, and is also a constituent. So it was pretty easy to twist her arm and get her to come on and talk a little bit about the SBA process for the small business owners that are on the line. And we have a lot of them in the district. So I thought it was very relevant to make sure that we're having that conversation. One of the things that I do want to disclaim, just like everything else, these rules are moving extremely fast. So anything that you hear now is subject to change within the next 24, 48 hours. So I'm going to try to update people as fast as I can through social media, through my newsletter, but make sure that before you take an action, if it's not immediate, that you do reference some of the more recent materials. So Jenni, if you want to talk a little bit about the Small Business Administration and the loan program under the CARES Act, so people can know what to expect tomorrow.
Absolutely. Thank you for having me tonight. I just want to start out and echo what you said at the start. This is very fast moving. It's a very fluid situation, and things truly are changing hour to hour under these programs. I know I sent you just sort of an outline late this afternoon, and then in this afternoon's the presidential update, he had Secretary of the Treasury Mnuchin and the SBA Carranza, the SBA Administrator Carranza, speaking, and there were some changes that were outlined in that press conference that were news to us. So I work for a bank. We are very involved in this process and overwhelmed, just like the Department of Labor is with unemployment claims. We're also overwhelmed with calls from borrowers who are seeking relief under these programs. So I'm just going to talk real quick on a high level about the programs that are available, and then we'll be glad to answer questions. There's really two programs that are available out there right now. The first one I'm just going to quickly mention, it's referred to as EIDL. That stands for Economic Injury Disaster Loan, EIDL, so EIDL. Those are the disaster loans that are administered by, processed by, and funded by the federal government through their disaster lending program. So lenders like mine are not involved in that process. A lot of you listening may have already applied for those loans because they were very immediately available, and they're already funding those loans. The second program that I'm going to talk about in just a moment is not even available yet. So many of you have probably already applied for EIDL loans. In fact, the latest data that we have, which was from earlier this week, over 1 million small businesses had applied for EIDL loans around the country. So it's been a huge outpouring. Because lenders are not involved in that, I'm not going to spend a lot of time addressing it. And also because there's a lot of more interest in the CARES Act program, and specifically the PPP, which is the Payroll Protection Program component of the CARES Act. And obviously, small businesses are very interested in this because they've heard about the payment forgiveness portion of that loan. So I'm just going to go over a couple of the terms and some of the things that you need to be aware of. To start, these are not yet available. Everybody is pushing, and particularly Secretary Mnuchin, that they will start to be available tomorrow. He has stated that money will also be available tomorrow. Quite frankly, I don't know a banker in this country that believes that that's going to happen. We are hopeful that we will be able to turn it on and start processing applications, but they simply don't fund same day. So it is our hope that we will be able to fund those pretty quickly, but same day is not realistic. Just to give you an idea of the scope of this, the CARES Act provides $349 billion for this program. And in a normal year, in the fiscal year 2019, nationwide SBA loans amounted to about $24 billion. And that was stretched over a 12-month period with many, many lenders. So you're talking about a very massive undertaking and a lot of moving parts. What you need to know as a small business owner, if this is something you're interested in, is that it is intended for use for operating expenses, and in particular payroll, for you to keep employees on the payroll. And so the program period begins February 15th of 2020 and runs to June 30th of 2020. So if you were in business and you had employees starting 2/15/2020, then you are eligible to participate in this program. It will allow you to request funds equivalent to 2.5 times your average monthly payroll. So you're going to look at the previous 12 months, do an average monthly payroll times 2.5 times. In addition, you can ask for money for rent or mortgage payments, interest on those loans, utilities, insurance, operating expenses, but not anything like inventory or equipment or anything like that. It's truly operating expenses. And just so you know, there was early on a lot of discussion that you couldn't have both an EIDL loan and a PPP loan. That has since changed. You can have both. You just can't double dip. So for instance, you can't request $25,000 under EIDL to pay payroll and then ask for another $25,000 under PPP. But you can, if you want, look at refinancing your EIDL loan into a PPP. And you may want to consider doing that. You want to look at all of your options. But the real benefit of the PPP is that as it stands right now, it comes with an initial 6-month payment deferral. So if you are approved, you are funded the loan. And for the first 6 months, you're not required to make payments. And then at the end of that 6-month period, if you have used the money as it was intended, then you can request payment forgiveness. And if you are approved, then that means you will not have to pay that money back. You need to be very aware, and I want to be very clear, that the payment forgiveness portion of this is not automatic. It is something that you will have to request from your lender, and then you will have to prove that you use the money as you were supposed to. For instance, if you borrow money for payroll purposes, you will have to provide canceled checks or reports from your, if you use a payroll company, reports and then corresponding bank statements to show that you in fact spent X amount of money as it was intended to be spent. So if you do not use it as appropriate, or you do not ask for the forgiveness, then at the end of the 6-month deferral, it will convert to a 2-year loan. You will have to pay off the balance in 2 years. And the interest rate, we believe, has changed. It was 0.1% going into today, but around 5 o'clock, it apparently changed to 1%. So we're waiting on further guidance on that. But it's a very low interest rate, but depending on how much you borrow, that could be a pretty steep payment if you're only paying it back over a 2-year period. So I want to be really, really clear that record keeping is going to be critical in this process. I don't want to get too in the weeds with too many details about this. So I'm just sort of glancing over to confirm what is included in payroll. And I'm going to, bear with me, I'm going to read this off just so I make sure I don't skip any of them. And with glasses, I got to do this. So the definition of payroll are payments of any compensation to employees, salary, wages, commission, or similar compensation, plus payment of cash tips or equivalent, plus payment for vacation, parental, family, medical, or sick leave, plus allowance for dismissal or separation, plus payment required for group health benefits, including insurance premiums, plus payment of retirement benefits or payment of state or local tax assessed on compensation of employees. So it's pretty comprehensive. And the idea clearly is that they want you to keep your staff on the payroll. You can also include, as I mentioned, other operating expenses, and those are enumerated as payroll costs, costs related to the continuation of group health care, salaries, rent, utilities, interest on debt obligation incurred before the covered period, so that would be before February 15th, and refinancing of idle loans. So those are the things you can include in the process. Now, we feel very certain that this money is going to go fast. There is an enormous amount of demand for these loans, as you might expect. I can speak, just my small lending institution has a waiting list of over 3,000 customers that are interested. I would encourage you to reach out to and speak to your banker. There are a lot of reasons that I'm not going to go into here, but the net result is the way these are structured at the present time, unless there is a change, as a bank, we will lose money on every single one of these loans that we do. And so we want to help our community, we want to help our customers, but we're only going to have a limited amount of appetite to originate loans that we lose money on. So you need to reach out to your bank to see if they are a participating PPP lender. Any SBA approved lender can technically make PPP loans, but not all lenders are opting into the program. And in fact, some are opting out. So your first question should be to reach out to your bank to see if they are participating. And then ask them what their process is. All of us are trying to put a platform in place to handle these loans. And so everybody has a slightly different process for it, but there is, most lenders have a checklist of items that you should prepare and be ready to provide. And so right now, until the spigot gets turned on and we can start processing these, my best advice to you is talk to your banker, but understand that they're probably overwhelmed with phone calls. So it may take them a minute to get back to you. Talk to your banker, confirm whether they are a participating PPP lender, and then ask them for a checklist of items that you can be pulling together so that as soon as this is ready to go, you can apply. And unlike a disaster loan, you as a small business send in your own application. Under PPP, you apply to your lender, and then your lender goes to the SBA. And so we are, because of the massive demand, we are anticipating that there could be slowdowns, there could be computer crashes. We can only process so many in a day. And so the sooner you can have your information ready and submitted, then the better off you'll be. So I have a ton more information. And so I think I'll probably just want to leave it at that. And if you have questions, fire away and I'll do my best to address those.
Yeah, there's a few questions. Kia, give me a thumbs up or down or something. Let me know whether or not your question was answered, because I know you had asked one, but I'm not sure if it's been answered. I'll come back to it. I've also got another one about the EIDL. If you've applied for the EIDL and you want to apply for PPP, can you choose which one you want to pursue?
Yes and no. So if you applied for EIDL, but you haven't received any money yet, then you can decide to say no thank you to EIDL, and you can just let that go away. If you've already received money under EIDL, then you have the choice of carving out a piece of it to be refinanced with a PPP. And so we will have some small businesses out there that end up with two loans, an EIDL loan and a PPP. Some people or some small businesses will elect to refinance their full EIDL loan into PPP. So you really have to look at the terms and the requirements. There is talk, and it's expected that under the EIDL loan, that what they're doing is initially when you apply for EIDL, when they start processing your loan, they immediately send out $10,000, which is intended to bridge you over until everything gets worked out. There is a pretty firm discussion that will be converted to forgivable and will be effectively a grant.
Okay.
Again, this is changing so fast that we really don't know. So it may be, I mean, I'm just picking numbers out of the air here, but if you applied for a $50,000 EIDL loan, you may want to keep 10,000 of it, hoping that will become a grant and convert 40,000 to a PPP. But effectively, you can have both. If you haven't received the money yet, then you have the most amount of flexibility. But you should definitely let your lender know if you have an EIDL loan in process or if you have received an EIDL loan, just so that everybody is aware of all the moving parts.
Okay. And just for clarification again, can you go through one more time what qualifies for payment forgiveness? What are the expenses that are qualified for forgiveness?
Yes. So I'm going to read this specifically. The amount eligible for forgiveness, a PPP borrower is eligible to have its loan forgiven in an amount equal to the following costs incurred and payments made during the covered period. So it would be these 4 items: payroll costs, plus interest payments on any covered mortgage obligation, payments on any covered rent obligations, any covered utility payment. Now, those are the 4 things that are eligible for forgiveness. So it is possible you will have a PPP loan where part of it is forgiven and part of it is not eligible. We also have a concern, just to be aware, that because of the demand for these loans and the intention that they're really intended to keep people on the payroll, we're already getting feedback, and we don't have final guidance, but we're already getting feedback that they're going to look to have 75% of your PPP loan related to payroll cost and 25% for the rent, the utilities, anything else. And so what that's telling us as lenders is that they're moving to a point where probably 75% is eligible for forgiveness and maybe 25% isn't. And that's a way of sort of stretching the dollars. We do not have final guidance on that yet, but that's where it's headed.
Okay. Thank you. If there are any other questions, go ahead and put them out. There's one out there about contact number or website to inquire if e-commerce online retailers are essential. I'll get you an answer on that. As I said, the governor's emergency order came out right before we got on the call, so I haven't had a chance to really go through all of it. But I'll put something out tonight on kind of what's included as essential, what's not essential, so that everybody's very clear. So I'll post that a little bit later. And thank you, Eric, for the thumbs up. Real quick, if you got any questions, go ahead and put them in. I know it's we're running a little bit longer than we normally do, but I think it's been good conversation. I do want to remind everybody that if you, and I say this every time we have one of these, but it's an issue near and dear to me. If you have someone that is inactive or long-term recovery of substance use, this is a horrible time for relapse. We need to be mindful. Reach out to them, give them a call yourself, but also know that the Georgia Council on Substance Abuse does have a warm line that anyone can call if you just need someone to talk to in regards to mental health or recovery. And that number is 844-326-5400. We have to make sure that we're all caring for one another. Also, if you know someone that's in the healthcare field on the front line, whether they're a grocery worker, a mailman, or mail carrier, if they're in the pharmacy, wherever, make sure you thank them. This is a very scary time for a lot of us, and we need to come through this together. And that's really been one of the good things that I think has come out of this. So any more questions? So I want to remind everybody of the things I said at the very beginning. Make sure you fill out your census information, my2020census.gov. Make sure that you, if your employer has not filed for unemployment for you and you have been laid off or furloughed, that you contact the Department of Labor on your own behalf. If you have any questions, contact me or my office. We'll be happy to get you in touch with them. And the primary election is May 19th, regardless of what you've heard. There has not been a change to the date. So the one other thing that I will say that I know people have asked about, but no one's asked about on this call, is the direct disbursements from the federal government. That's come up as well. The last guidance on that is those payments should start flowing in the next 2 weeks. But if you have asked that question, I'm going to consider this part of the response, and then we'll put some more information in the newsletter next week if anything changes. But I want to thank Dr. Memark from the Cobb Department of Public Health, Denise Beckwith from the Department of Labor, and Jenni Shover, who's talked about the SBA process. If you want any of their information, just contact me afterwards. I'm not going to give Jenni's phone number to everybody, on the on the video. But if you have any questions or want to contact her directly, let me know. But if you do have a banker that you work with, as she said, they are more than happy and willing and ready to assist you through the process if you're a small business owner. So thank you everybody for joining. Have a great night, and we'll see you next time.
Thank you.
All right, bye-bye.